Good morning, everyone. I'm Deb Crawford, your Vice Chancellor for Research. Chancellor Plowman couldn't be with us today, and so she asked me to lead our live update. I'm joined by two frequent guests to our live updates, Dr. Spencer Gregg, Director of our Student Health Centre, and Dr. Frank Cuevas, Vice Chancellor for Student Life. Thank you both for being here this morning. Let me start by extending a big orange welcome back to campus. I hope you had a restful winter break with family and friends and that you're looking forward to a great semester of learning and personal growth. I want to thank all our faculty, staff, and administrators who worked so hard to prepare the campus for the new year and the new semester. As you know, classes started on Wednesday, and it's just wonderful to have everyone back in the classroom, in person and online. Our facilities staff have spent a lot of time setting up socially distant classrooms, ensuring sanitation stations are filled with supplies, and repairing and replacing signage and floor markings. We are so grateful for all that they've done. Now, before we get into today's data, I want to take just a minute to remind everyone of our health and safety protocols. We have been getting reports and emails from concerned students, parents, and others about individuals who are not adhering to the safety measures on campus, which is obviously troubling. We're asking you, our students, to please remember the volunteer commitment that you made at the beginning of the academic year to do your part to keep everyone on campus and in our community healthy and safe. This means wearing your masks, following social distancing and other safety guidelines. As we have had students return to campus from all over the country, including areas where virus prevalence is higher, we have additional temporary restrictions in place just now, including 1, there's no visitation allowed in the residence halls, 2, we have carry-out only dining, and 3, we have limited in-person events. Now let's get to today's data. As of this morning, we have 73 active positive COVID-19 cases. 56 are students and 17 are employees. This total includes 15 new recoveries. There were 2 new active cases reported yesterday. We now have 209 people in quarantine or self-isolation. Of those, 152 are students. We expect these numbers may rise over the next week or two as we have significantly more people on campus than we had a week or so ago. We have some control over how much these numbers rise. If we all wear our masks properly and observe all the safety protocols in place, we'll be able to minimize transmission of the virus such that disruptions to our semester will be as modest as possible. Now, Dr. Gregg, what are you and your colleagues seeing at the Student Health Centre around testing? We can't hear you, Dr. Gregg.
Sorry about that. Getting back into the swing of things. Good morning. It's good to be with you and Dr. Cuevas this morning. Dr. Crawford, as you've noted, as students, faculty, and staff return from winter break, we did expect to see some increase in our number of new cases and active self-isolations on campus. What we're seeing thus far is really consistent with what we'd anticipated. What we hope not to see is a similar significant surge in cases as we did early in the fall semester, and we can help ensure this doesn't occur by all of us strictly adhering to appropriate health and safety guidance. Of significant importance within that guidance, especially due to the recent developments of strains that are more readily transmitted, we need to continue to adhere to appropriate social distancing, which is avoidance of being within 6 feet of others for more than 15 minutes cumulatively over a 24-hour period. We need to be sure we're consistently wearing our mask when we're around others, especially those that aren't members of our immediate household, and pay particular attention to appropriate regular hand hygiene to help prevent the spread of infection. In regard to what we're seeing at the Student Health Center, our traffic has started to pick up, so we want to make sure of a few things. First, students who have symptoms potentially concerning for COVID-19, we want them to know that they should schedule an appointment through our telephone triage nurse for a provider evaluation and provider-directed testing. Employees with symptoms should schedule with their private healthcare provider. Also, this semester, students without symptoms may schedule for a COVID test online through the Student Health Center patient portal, which is accessible through the Student Health Center website. And as before, students and employees who are, again, without symptoms, but are concerned about a recent exposure, they can choose to pick up an Everlywell COVID at-home collection kit at the Student Health Center for convenient at-home testing. No appointment is needed to pick up a kit, and there's no charges for the use of those kits. And finally, for our students who are participating in our community saliva testing program, within a day or two of participating, those in a positive pool or who submitted inadequate samples will receive an automated email from our medical record system with instructions on scheduling their required follow-up testing at the Student Health Center. So all students participating in the community testing need to closely monitor their emails to see if they're required to have that follow-up testing performed. With all these measures, we're really hopeful that our entire community can have a significant impact on lowering our infection rates on campus this semester.
Thanks so much, Dr. Gregg. Now let's turn our attention to the metrics table that Chancellor Plowman introduced at last week's live update. This table, as you can see, includes indicators that we use when evaluating whether to tighten or ease temporary restrictions on campus. We've already talked about cases here on campus. If cases rise, metrics associated with things like isolation housing capacity, contact tracing, and testing turnaround times will also be impacted. As you can see here, we're also monitoring cases in Knox County. The good news is that new cases are trending down a bit in the county, a 15% reduction over last week, although available adult hospital beds remained reasonably flat at about 8%. Dr. Gregg, can you say a little more about why we're tracking Knox County data and why it's important to our campus community?
Certainly. Our campus community is really a community within a broader community. Just as what happens here on campus can impact what happens in the broader community, what happens in the broader community can impact what happens here on campus. So just like we monitor our campus data, we're also monitoring what is happening in the broader community to inform us regarding what additional actions we might need to take to either escalate or de-escalate the restrictions that we have in place. Increase in the active cases or hospitalizations within the broader community would trigger us to reassess our current footing and make determinations regarding our present mitigation strategies. You've heard it said that no one is an island, and that's true of our campus community as well.
So true. Thank you, Dr. Gregg. We'll revisit these metrics every Friday during the live update. Now, we've also restarted our community testing program this week. Over winter break, we built up our lab testing capacity to support weekly COVID-19 testing for all residential students. Every student who lives in our residence halls and Greek housing must provide us with a saliva sample every week. We have an events calendar that describes all of the testing dates, times, and locations if you forget when yours is. Community testing was hugely important last semester. It helped us understand virus prevalence among our residential students, and it helped us thwart transmission by identifying students who were carrying the virus but didn't know it because they didn't have any symptoms. By expanding this testing program, we'll be even more informed about the health of our campus community, and we can more quickly and accurately pinpoint outbreaks of the virus. Since just Wednesday this week, we've collected over 1,900 samples. We've begun processing these samples and so far have made 13 referrals for further diagnostic testing at the Student Health Center. Once we're in full swing with community testing, we expect to process as many as 8,000 saliva samples each week, including samples provided by some of our off-campus student community. Now, Dr. Cuevas, what can you tell us about how well testing collection in the residence halls and Greek houses has gone this week?
Thank you, Dr. Crawford. As you shared earlier, our community testing just started this week, and so far we've seen great participation rates and things are going very smoothly with the testing program. So I want to thank our students for their participation and their engagement rates. And I also want to remind our students that we know they're excited to be back. and they're excited to not only to reconnect and sort of reestablishing a return to campus routine. So I want to remind them that as part of your routine in getting back to campus, participation in the community saliva testing program is essential. So incorporate that into your daily routine. As you shared earlier, we do have a COVID-19 events calendar, which shows which calls we're testing when and where and locations and times. So it's a good thing to refer to that and to incorporate that into your daily routine. I also want to share that as part of the participation rates, there are a number of incentives in place to help individual and community incentives that students can be a part of, not only by participating in the pool saliva testing program, but also by completing the daily health screenings, both of which are essential. Lastly, I want to just share that as we integrate back into campus and our students are around, to practice all the protocols we talked to Dr. Greg mentioned earlier, those safety protocols which are essential for us to keep in our campus healthy and safe. And as we see where the prevalence is, that will allow us to reduce restrictions across areas of campus. For our commuter students, I just want to say that we encourage you to participate. Your participation is essential to helping keep our campus and community healthy and safe. You can log in to MyUTK and register for the community pool saliva testing program, and I highly encourage you to do so. We have various locations across campus where we're collecting the samples for those students who do not live on campus or in any of the sorority and group housing. So thank you again for your participation. Keep an eye on the calendar as we're testing almost 8,000 students weekly. So keep it up. Great work.
Thanks so much, Dr. Cuevas. Well, our live update is drawing to a close. Thank you for joining us today and for being willing to do your parts in helping to keep our community safe, ensuring we can continue to learn and grow together over the coming months. We look forward to seeing you next week at the live update. Go Vols.